Our growth outcomes on the exclusive human milk diet have been good in our analysis of our kind of pre and post populations. Growth was as good, right about 16 grams per kilo per day. So as we described with using Perlac CR when needed, we really have not had issues with growth.
And we've learned to really look at the volume that we're providing and make sure that the concentration that we are providing to that baby meets those needs. So honestly, that's one of the reasons we start with ProAct Plus 6, is we can achieve our nutritional goals with a smaller volume.
Well, and I think taking a look at each individual patient, and I think the thing that I really enjoy about the whole product line is that there are so many tools that we can use in our nutritional toolkit. So it's not only that we can use the Fortify or the Plus products, but also using the CR product when needed, and having it be a thing where you can look at the actual individual patient and chart their progress. So it's not a static type of plan, it's more of an evolving plan and supporting what they need for growth at that period in time. I think with growth and talking about poor growth is really just staying on top of it. And I think that looking at what that patient has done historically is just as important as where they fall on their growth curves. So looking and getting to know, we all know our patients, and really taking a look at what they need at that point in time. The poor growth is really preventing it and being able to stay on top of their growth.
Yeah, I think if you do notice poor growth, though, it's important to look at what's surrounding the baby. Was there a change in medication? Are there other things that could possibly be contributing to that poor growth, besides making sure that you're meeting your needs, you're meeting your energy, you're meeting your protein needs, but what else is going on with the baby to make sure that that might not be contributing, or if it is, how can you handle those extraneous circumstances?
Yes, I agree that it's been very helpful in our unit to have the discussion with the whole team, whether on rounds or sometimes I'll go back to the bedside nurse and also the physicians and as you said, discuss, are they weaning oxygen support perhaps, and that might be contributing to more caloric demands that the infant has, or diuretic use, etc. And so taking in the whole picture, looking at labs, making sure we're supporting the baby in every way needed. I think another area that it's helped, we are quicker to discuss whether fluid restriction is needed or not, because we want to support the exclusive human milk diet and provide it in needed quantities. And often the discussion has resulted that we don't always have to fluid restrict, and that has been helpful to make sure that we're not necessarily withholding some nutrition.